Good afternoon, everyone, and a warm welcome to all of you joining us here in Bangkok at ESCAP and those tuning in online from the Asia and Pacific region. We're delighted to welcome you to this important and timely event, Transforming Urban Care Systems, a whole-of-a-society approach to resilient and sustainable cities. My name is Carla Correa, UNICEF Child Rights and Business Specialist, and I have the honor of being your MC today. Together, we will explore how cities around the world and in the region can become more inclusive, equitable, and sustainable by reimagining how urban planning can serve as a tool to promote care and support for people, communities, and the environment in which we live in. Before we begin, we'd like to extend our deepest gratitude to our host partners who have made this gathering possible. Our special thank you to UN Women Regional Office for Asia and Pacific, and the United Nations Economic and Social Commission for Asia and the Pacific for providing the platform and the vision for today's discussions. We're also grateful to our supporting partners, stakeholders, and everyone who has contributed with their time and expertise. Please allow me to share with you some of the housekeeping rules for our session today. I'd like to remind all panelists to switch on their camera during the entire panel discussion. This will help keep our discussion more engaging and lively. Let me also inform all participants, in case you would like to listen to the session in Indonesian, please select Arabic from the interpretation menu online. To set the stage, we're honored to begin with opening remarks on transformative care system in Asia Pacific. Please join me in welcoming Christine Arab, UN Women Regional Director for Asia and the Pacific representative in Thailand, to the stage. The floor is yours, Christine.
Thank you so much, Carla. And I want to start off by thanking UNICEF and ESCAP for their leadership and partnership on the issue. And taking this opportunity to highlight something which for UN Women is integral to women's empowerment, and that is the care economy. It is both the reason why we are free to leave our houses and do what we need to do and want to do, and also an enormous opportunity for women's economic livelihoods as well. So I really appreciate this, and I want to thank all of our partners. Nadira, it's a pleasure to meet you, and the team, the UN Women team of Katya and Cecilia and team for organizing our side of this. I want to, when we look at our cities in the region, we're at a bit of a crossroads in terms of equal measure opportunity and risks. We have rapid urbanization on one part of our region, well, across the region, aging populations, but in different parts from South Asia to a huge youth bulge to East Asia and Southeast Asia, where in fact the demographics are quite different. And the elderly needs and care are significant. Care work, despite the fact that it is discussed a great deal, despite the fact that of the 193 member states in the UN, none have effective gender responsive care that meets the demands of their country. It still remains a seriously underfunded, misunderstood issue, particularly in urban settings where infrastructure, public services, and political frameworks have yet to fully adapt care needs across the life course of women and girls and men and boys. That's why we're here today. And if you look at a more bold vision of caring cities, and we look forward to hearing some of the experiences. I know in China we work closely with UNICEF's experience on caring cities there, and we look forward to hearing more. It's essential because the models we have seen, these are inclusive, they are resilient, they are meeting the direct, very daily needs of the families in a safe and progressive and enabling way. And it recognizes that everyone at some point in life will have to give or receive care. And from a gender perspective, the more that we can distribute the giving of care, the better it is for everyone. And I think we sit at a table with UNICEF and ESCAP, who have done a significant amount of research to see how this strongly benefits children in particular when they have the equal engagement of their fathers and mothers, the women and men in their households. However, when you get into urban planning, what is needed is, as I said, direct models and direct examples and very, very pragmatic examples of how this is not necessarily a more costly endeavor, but a better use and a more efficient use of resources. UN Women has worked closely with our UN partners to align global guidance, such as the UN System Policy Paper on Transforming Care Systems, with concrete actions at the local level. We are proud to be convening the Transform Care Investment Initiative in Asia and the Pacific, which is a regional movement, which we do in partnership with the UN, including closely with UNICEF and ESCAP, to mobilize investments in care systems that are inclusive, that are resilient, and that are green. Together with governments, social enterprises, and other UN entities and agencies, we're co-creating solutions, including supporting care mapping and costing care delivery models in cities like Dhaka and Kathmandu, building private sector models for delivery of childcare services, and you will hear later today the panel session from impact entrepreneurs such as Kiddo Care out of Malaysia, a digital-enabled care enterprise, our Dharma Life India, which works towards translating investments in care into women's economic empowerment. And we advocate for the adoption of family-friendly policies in the workplace. Let us today, in today's dialogue, spotlight the practices, highlight that this is a cost-effective manner, that you don't have to have the GDP of a global north country to, in fact, effect the changes that we're seeing when it comes to combining urban planning with a child-friendly, gender-responsive care approach. Thank you very much.
Thank you so much, Christine, for inspiring message in terms of conceptualizing the care framework, which is a milestone for the UN agencies, and it's a guiding book for our work in this space. And in this note, I would also like to welcome Mio Zinut, UNICEF East Asia Pacific Regional Office Deputy Regional Director, to say a few words. Over to you, Mio.
Thank you very much, Carla. Good afternoon, ladies and gentlemen, and my UN colleagues. It is my great pleasure to join UN Women and also UN ESCAP together in this important session, really looking at the transforming, urban care system. We are here to forge a new partnership, new networks, learn innovations from each other, and share our commitments to make sure that cities are not only to live, but also transforming cities to care for everyone. And in UNICEF, we really believe that every child has the rights to grow up in a safe, nurturing, caring, and enabling environment, regardless of the context where they live in. And the care is fundamental for the positive outcomes of all children. I just want to highlight a few years back, we all experienced COVID-19. COVID-19 has taught us a lot of lessons. During COVID, we were locked down, schools closed. So, the families, especially women and girls, become a huge burden for caring of the children. So I think that's where, we need to really look at it, and how this unequal distribution of care work and unpaid care work domestically falls on the women and young girls. I think that's also important. The role of the schools providing some care for children, these are also important. But fast forward 2025, in Asia Pacific, the existing policies and structures are still not sufficient really to provide comprehensive care for children across the life course, from infant to adolescent to adulthood. So the region still, we rely a lot on families, especially, creating gender imbalances in unpaid care work, and also, caring burden really falls on the shoulders of the women's and girls' work, rather than it's a shared responsibility. So we are here to really, together to reflect on the gender responsive, disability inclusive, and contextually relevant childcare and support systems in our cities. Some of the thinking that I would like to share with you: care and support is Fundamentally, it's a human rights issue, child rights issue. We all deserve the children throughout the life course. And also we need to look at the needs, the autonomy, and also the dignity of the caregivers on one hand. At the same time, the care receivers, the children, the adolescents, the disabled, and also the elderly. I think we need to look at the both ends of the caregivers and care receivers. And also looking at across the life course. I think that's important from childhood till the adulthood. And also integrated systems approach, not only providing education or health, but integrated system would really help. And in the region with the early marriage, we also have experience of adolescent parents. So I think we need to also support them how to really prepare them as a caregivers. And of course, the most important thing, the collaboration between the public sector and the private sector, these are important. I just want to highlight two things that, in UNICEF, we've been working in 82 countries globally at both national and the subnational level to support the care work through the family-friendly policies with the private sector and public sector. Also, we have some initiatives, working in the region with the child-friendly city initiatives, bringing child rights closer to the local government units and working closely with the local governments to ensure that, the child rights are implemented at the local government level. So I'm really glad to see our colleagues from Shenzhen in China and also Surabaya from Indonesia joining us today to share their experience with us. So strengthening policies, programs, and services are fundamentally important for the welfare of the children and adolescents and the young people. And also, this is also part of our mandate, and we want to really highlight we need together collectively a much bigger response, a response that reaching every child, every woman, every families, communities, and city with a care concept, and also a response that really helps urban resilience, especially that when we hit the disaster, the recent earthquake in Myanmar. I mean, the region is very prone to natural disasters, so a resilient urban setting is also important. The region is very vibrant with the digital transformation, so a digitally innovative approaches are also needed. Multi-sectoral collaboration, I just want to emphasize, and also the need to work at the multi-levels, national level, subnational level, community, family level. And finally, the importance of the private and public sector partnership. We need to have all colleagues, implementers together to have an effective and coordinated solution. On behalf of UNICEF, I want to thank you for joining us today, and your engagement, your insights, your commitments really make this event truly impactful, and look forward to this opportunity and wish you all the productive session. Thank you very much.
Thank you, Mio. And thanks for setting the stage for us to understand better the issues and some of the opportunities ahead of us. I'd like to invite you all for our session, our first session. We're going to have some keynote presentations. Let's dive into leveraging data ecosystems approaches to transform care systems. This session will explore the foundational concept of urban care systems that encompass why they matter, how they interact with other parts of the urban ecosystem. Please join me in welcoming Cecilia Tinoning, statistics specialist at UN Women Regional Office for Asia and the Pacific, who will present on geospatial mapping for care equity and care delivery models. The floor is yours, Cecilia.
Thank you so much, Carla, and thank you so much, everybody, for joining us today online and in person. At UN Women, we work toward overcoming the structural barriers that limit gender equality and women's economic empowerment. And one of the most persistent of these structural barriers is the unequal division of unpaid care workloads between women and men, as well as girls and boys. Caring cities are emerging rapidly as a promising local solution that puts care and equity at the center of urban development. And in doing so is really promoting solutions to overcome these structural barriers. Caring cities are about cities that are shifting the way they think, they plan, they invest, not as neutral spaces, but as engines for gender equality, well-being, and economic inclusion. Caring cities recognize that gender equality starts at home within cities. Women and girls provide more unpaid care services and spend more time on these unpaid care services compared with men and boys, and this limits their ability to engage not only in employment and leadership, but also education. Most importantly, these subsidize critical sectors such as, for instance, health and education, and during the COVID-19 pandemic, this became very, very clear. Local solutions can reduce and redistribute unpaid care workloads by expanding access to quality and affordable care services. Caring City also recognizes that care is a universal need that is met locally. Every individual requires a certain amount of care across the life cycle, and cities and communities are at the front line for delivering essential services such as childcare, elderly care, as well as disability support. But local government and municipalities do not have only the responsibility, but also the opportunity to invest furthermore and move the needle toward caring cities through, for instance, controlling critical infrastructures for care, such as, for instance, water, electricity, but also transport, early education, as well as social services. Embedding care into urban planning and design can enable tailored, inclusive solutions that are also gender responsive. Investment in local actions can trigger positive impact at the country level. Investing in urban community-level care systems can boost women's economic empowerment, but can also create jobs for both women and men, while strengthening resilience to climate shocks as well as demographic shift. And in doing so, they do it where it matters the most, which is closer to people. Next slide, please. Investing in urban development is critical for care systems. Urban development is intrinsically linked to the effectiveness of care systems. The way cities are designed directly affect how care is given and received. A walkable city or a nearby care centers make a world of a difference in the lives of both the caregiver and the care receivers. Cities that integrate care into disaster planning protect the most vulnerable ones, especially women and children, who are usually the most affected by climate-induced disasters. But cities are also at the forefront of responding to megatrends, such as, for instance, aging populations. And these are increasingly asked to provide accessible services and public spaces that support a growing older populations. Caring cities are put at the center the voices of communities. When communities shape planning services better reflect local reality, participatory planning actually ensures that care systems are relevant, equitable, as well as culturally sensitive. So a city built with care in mind is not just more inclusive, it's also more resilient, healthier, and livable for all. Next slide, please. So why aren't care systems working effectively at the local level for all women and girls and children? Traditional data is actually very much limited in offering us insight on how care systems work at the local level. So the answer is fairly simple. We can't manage what we cannot measure. Yet there are increasing innovative data techniques that allow us to integrate geospatial mapping, gender statistics, as well as real-time analytics that allow us to understand at the local level the care dynamics with precision and nuances. In collaboration with Data Pop Alliance, we conducted research to support stakeholders at the country levels in cities in the region to inform actions toward caring cities, and cities such as, for instance, Kathmandu Metropolitan City, but also Dhaka. We started by mapping the demand for care services by looking at the distribution of the population by age groups within city to better identify children as well as population in old age and their distribution within cities. Population and household censuses actually provide us also very granular understanding and information also on population with disabilities, where they are actually distributed within the city, as well as important indicators on the attachment of women to the labor market or the lack therein. When household population data from the census is not actually available or too old, then we leverage satellite imagery for understanding the population distribution and the care and the demand for care needs within cities. We then overlay to understand then the supply of care services to better identify the areas in the city where care is actually needed, so where there is a mismatch between the demand and the supply. We leverage business registers and education management information system data, but what made us really learn something and move the needle was to actually leverage real-time analytics from crowdsourced data and web scraping, which was telling us a more comprehensive story. So it was able to capture more, for instance, informal arrangement, not registered necessarily in business registers. We then leverage existing tools, such as, for instance, the WHO Access Mode, to understand the travel time between in different areas in the city to access care services. We built on this UNDP methodology developed in 2022, but we built also a more granular understanding, such as contextual factor, land use, and informal settlements to enhance a leave no one behind lens, as well as understand in the city where women and girls and children actually were more exposed to climate risk, for instance, flooding, as obviously this directly affect not only the demand, but also the supply of care services. Next slide, please. So let me please show just 3 key lessons learned from DACA. DACA care dependents, primarily children under 5 and adults in old age, face care service gaps. We found on average 1 care facility per 1,000 children. And we found that elderly care services were actually clustered in affluent areas, making low-income communities drastically underserved. We also found that in the most vulnerable area of the cities, 11% of care dependents live in informal settlement, 9% in flood risk zones, where actually the gaps in care services was the most acute and severe. Combined with declining green spaces and weak public infrastructure, this risk deepened the care demands for women. Despite 80% of DACA population actually lives within 15 minutes of a childcare facility, supply remains actually insufficient. So overall, these analyses allow us to build care maps, but also enables decision makers to pinpoint care desert and direct investment in climate resilience, accessible infrastructure where is actually needed the most. To conclude, rapid urbanization is actually. Next slide, please. Rapid urbanization offers us a chance to reshape urban spaces in caring cities with care and equity at the core of urban development. Our analysis led us to identify at least 5 key recommendations that are based on the evidence emerging from our research. First of all, investing in digital and geospatial technologies is critical to build care maps, but it also requires investing in care business registers, including through leveraging digitalization. Advance gender-responsive care policy and legal reforms to formalize care work, expand affordable services in underserved areas, and promote women's economic empowerment through decent care work. 3, promote public-private partnership to expand affordable, high-quality care services, support caregivers with decent work, and integrate care into formal labor markets to boost women's economic participation. 4, integrate climate resilience into urban care infrastructure by investing in adaptive care facilities, disaster preparedness, and green spaces. And lastly, invest in care systems at the local level to increase resource allocation and, most importantly, gender-responsive budgeting, including at the city level. Thank you so much. This was just a snapshot of our research. There is, next slide, please. For those that are interested in more information, here is the link to our publication. Thank you so much. Over to you, Carla.
Thank you very much, Cecilia. Thanks for highlighting the key elements of how we can build a caring city model, and especially using data systems and the importance of the different data methods that can be available for us to shape more caring environments for all that receive care and those who also provide care. With this in mind, I would like to invite my colleague Mona, UNICEF Social Policy Specialist, who will join us online for a presentation on urban resilience and child-responsive governance. Over to you, Mona, if you're ready.
Thank you so much, Carla and colleagues, and a warm welcome from my side. Next slide, please. So we've heard it multiple times before. We're in an environment, especially in the East Asia and Pacific region, where we have two developments currently, or two faster moving developments than in other parts of the world. And one is a rapid urbanization that is faster than in many other regions in the world currently, where we're also facing a change where we have rural areas becoming urbanized, and at the same time we're looking at developments of mega cities in many places. At the same time, we have demographic shifts with an aging population, which also means that budget is differently allocated. So when we're looking at different age groups, and we also experience that budget allocations are moving away from children and young people often. This means that we're looking at the gap that widens, an inter-urban inequality gap, where we see that urban growth outpaces investments in services and infrastructure that is crucial for the development of children and young people. This often also leads to a new or a rise in the urban poor, which includes migrant children and families. And this also has changing dynamics in regards to caregivers and the care economy as a whole. At the moment, we have half of the world's children living in cities, but this trend, or we predict that by 2050, this is about 70% of all children. At the same time, we also know that children and women are disproportionately affected by urban shocks, such as climate change, migration, economic shocks, conflicts, disease, pandemics, and so on, because they are more vulnerable than other groups of society. And we also know that urban planning and development strategies and policies often overlook the particular needs of women and children. And this is often also due to the high speed of the rapid urbanization that does not include all the different needs that we have in society. That could also be linked to mobility and infrastructure, for example. We also know that if we do have urban policies and frameworks and development strategies that protect but also strengthen women and children by looking at them as part of the society, then we also can make sure that we keep it on the political agenda, include them in urban planning strategies, development strategies, and strengthen urban resilience of all different groups in society. Next slide, please. So when we're looking, next slide, please. Thank you. So when we're looking at local governments, we also know that they have a particular responsibility. We've heard it before, they're the direct environment of children and women, and the younger children are the less they move. So the radius of children is smaller and it grows the older they get. But that means that it's crucial for children to develop and for their well-being that they have the supporting infrastructure and offers in their direct environment at the local level. We also know that children and women often lack voice, especially in policy making and planning strategies. They're hardly ever directly involved. So when we talk about a needs-based, evidence-based approach, then children and women are often overlooked in those processes. And we know this is particularly the case when it comes to urban planning, where they often say it's too technical, it's too difficult to understand. So for simplicity reasons, it's easier if the experts do it, but without ever consulting people that actually benefit from the infrastructures and services. And we also know that if urban planning and strategies, development strategies, exclude the views or the voice of children and women, then this reinforces inequalities and leads to unsafe, unresponsive urban environments. And also, we've heard it before, local governments, they have the possibility to influence national legislation and development strategies. So if we start from the local level, we can actually have that impact at the national level. Next slide, please. With UNICEF, we have a initiative, the Child Friendly Cities Initiative, that is globally implemented and also across the East Asia and Pacific region, where we have more than 150 cities involved currently and many more to join. And the goal of the Child Friendly Cities Initiative is the implementation of the UN Convention on the Rights of the Child that actually protects, promotes, and includes children and young people, and therefore has that impact on their development and well-being. The Child Friendly Cities Initiative approach is a holistic approach that includes stakeholders across societies and governments and works together not only with the let's say the usual suspects that are working with children and young people, but also with urban planners and care services. We also link the care economy to the CFCI framework because we know that the care infrastructure services and the care economy as a whole has an influence or influences and shapes the development and well-being of children and young people. Next slide, please. So if we look at a child responsive and gender and disability inclusive urban governance, we need to go beyond the sheer infrastructure and reflect upon the system in a holistic, broad way and make sure that we do give voice and space to children and women's needs in urban planning and policy making. We also need to make sure that we do not only provide infrastructure and services, but we also need to make sure that we generate access for all children and women to those services. That can mean that we need to reduce burdens, that could be subsidies, that could be the information about those care infrastructures or services for children and women, to make sure that we do not only provide the infrastructure, but to also make it accessible to everyone. And by providing a framework, a policy framework, or another framework that could be the Child Friendly Cities Initiative, that could be a family-friendly policies framework, etc., a care economy. By building those frameworks, we can make sure that it keeps on the political agenda and we do create accountable systems. Next slide, please. So to conclude, at UNICEF, we promote triple win policies that address all different levels, that target children and young people and foster their development and well-being, but also focuses on women and caregivers because those are the ones that share or have most of the burden, and we need to make sure that we also strengthen women to participate in the economy, and through that we also strengthen the whole system, the society and the urban system as a whole. Last slide, please. To make sure to implement the Child Rights Convention and all other international legislation that we have, we need to make sure that we put women and children at the heart of local government policy making and strategies. We need to give them a voice and involve them directly through participatory approaches, and also link child-friendly governance to a care system in a broad, holistic way that includes all different stakeholders at all different levels. Next slide. Just to conclude, a city that works for children and women is a city that works for everyone. And if we keep that in mind, we can build stronger, more resilient urban spaces for everyone. Thank you very much.
Thank you so much, Mona, for highlighting the important components of the governance structure for a city to have to become a caring city. And I think it's very clear to us that for us to have a city of care, we need to build the systems of care within in the context of the urban planning. And with this in mind, I'm very happy that we approach now the panel discussion. and with online room with guest speakers from Asia Pacific who will provide some of these experiences that are shaping up and how to take a whole of a society approach to transform care systems in the urban planning. For this, I have the pleasure to invite my colleague Katja Freyward from UN Women's Economic Empowerment and Migration Lead in the region, who will moderate the panel. Katja, the floor is yours.
Thank you very much, Carla, and thank you, everyone. I think I have the fantastic opportunity today to bring everything what we've heard now in theory, in data, in policies alive. And therefore, we have a really great panel with us, very diverse from different countries across the region, but also from different sectors. We are short in time, everyone, so we're going to do this a little bit energetic. I would love to have our speakers trying to please stay to 5 minutes. Maybe just to give a little bit of context, we're going to really unpack a little bit the intersection of urban development, transforming care systems, and gender equality, as you have heard. And as well, Christine and the other speakers before shared, it's a multi-stakeholder approach. It's a whole of society approach. We need more people to work on this. And that's why we are really grateful that we are here at the Urban Development Planning Summit, where UN Women, nor UNICEF, and some of our speakers also not necessarily are represented. So we are really grateful that we are here today. And I just wanted to share, Christine mentioned in the beginning that UN Women is convening this multi-stakeholder platform, the Transform Care Investment Initiatives. And I would love to invite everyone online, and just for everyone also to know, the room looks not so filled, but online we have more than 100 participants. So thank you to everyone who's joining us online. And if you want to join and learn more on the Transform Care Investment Initiative and be part of these conversations, I think we're going to put a link in the chat or a QR code. But I think everyone is much more interested to hear how can we actually get started. I'm sure there's city governments out there that have said, oh, I'm not part of this and I want to be part of this. And I think our first speaker will really help us on this journey and build confidence. I have the pleasure to have here today Sunita Dangol, who's the deputy mayor of the Kathmandu city. And people who know Sunita will know that she is very energetic. She drives youth empowerment, gender equality, and urban innovation. And we had the pleasure to work with Sunita and her team to get started on this journey. So we're very early on. And Sunita, I would love to hear two things from you. First, what's a caring city for you? And the second, what I also would like to hear, how did you embark on the journey? What can others learn from Kathmandu, and what's the entry point to do such work? Over to you.
Thank you so much, ladies and gentlemen, esteemed colleagues and distinguished guests. Namaste. It's my honor to be here today virtually to link with you and also put my verdicts on the theme, transforming urban care systems. So as a deputy mayor of Kathmandu, I'm very pleased to share some of my experiences and also thoughts in initiating the step to transform the care system in Kathmandu. So talking about the Kathmandu itself, we are very rich in our traditional neighborhood. We have rich history of community care space like courtyards and also gathering areas that actually fosters the caring environment. However, as we have also listened about the modernization, and so the city has also evolved due to the modernization and also population growth. And we must adapt to meet the modern care needs with the demographic changes that we have in Kathmandu. So to me, caring city is one that actually preserves the rich traditional and also cultural spaces while placing care, well-being, and also equity at the heart of the urban planning. It also addresses the needs of all the residents, particularly the vulnerable group. So to me, caring city is not just about having proper infrastructure, it's also about supporting and also improving access to various support systems for women. For example, we have also taken the significant step to becoming a caring city by investing in expanding accessible childcare and also elderly care services within Kathmandu metropolitan city. We have also established breastfeeding centers to support the women in balancing their caregiving responsibility. And it's not enough yet, but we have actually initiated multiple steps to ensure a caring city. Additionally, we have also prioritized the safety and also mobility by ensuring our streets are well lit and our transportation system are well improved. We're also investing in transportation system as a city and also allowing women and girls to move freely and confidently across the city. So, talking about the steps that we have taken, our approach to gender responsive urban planning goes beyond infrastructure, as I have also mentioned. We have created spaces and also supporting ecosystem that actually upholds women's fundamental rights as human rights. In each 32 wards of the Kathmandu metropolitan city, we have established women's network that actually offers the system, the support, legal support, and also psychological counseling. And these networks helps to build the traditional women group model and also address the gender specific concern within our cultural context. And it has also ensured the meaningful participation of women in the decision making, because the women cell that we actually name it women cell, and women cell is led by the women elected representatives. Regarding the enabler and also challenges that we have, data is actually the key. It has the crucial role in gender responsive urban planning and also to address the gender specific care needs, ensure the equitable resource allocation. For the cities like Kathmandu, the scientific and also real time data is very essential for designing adaptive care infrastructure, because we have 5 times more of the floating population than the permanent resident living in the Kathmandu. But due to rapid urbanization, as there is high mobility, fragmented, and also offline data sources that make it really difficult to track the real time information, and that hinders the evidence based decision too. So, in order to overcome these challenges, we are now developing the integrated data system that consolidate offline and also scatter data into the unified platform. We are also very happy to share you that we are collaborating. We are collaborating with the partners like UN Women to use GIS mapping to map the existing services under the local units, identify the gaps and also opportunity in the care demands and supplies to engage the further expand of the services and also realign them proportionately to the population cohort across the metropolitan areas to expand our care infrastructure and also to enhance the service delivery as needed. However, a caring city approach also requires the whole of a government approach. It's not just about local government, it's also about multi stakeholder collaboration, including civil society, development partners, and also the expert to ensure the diverse perspective in the urban planning. And through the participation, partnerships, and also consultative processes, we can build a city that promotes well being, safety, and also connection for all the residents. Integrating care into the urban planning and also strengthening community care infrastructure and services is the way forward to make city caring and also inclusive. And Kathmandu metropolitan city is actually working on it, and also we are identifying and also piloting the care model that are responsive to the context and the need of the population. As per our experience, something that or the city can also learn is it's very important that we start with the data itself, and it's very important that we see if we have the data. That's one of the lessons that we have learned throughout the journey. And so in conclusion, I also want to emphasize that Kathmandu is committed to transforming urban care system, and we believe that investing in care infrastructure and also fostering collaboration can actually build the resilient and sustainable cities that can actually serve all the segments of the population, including women, children, and the most vulnerable communities. So let's work together to create a future where every individual is they not only feel cherished, but also feel cared and supported. Thank you.
Thank you so much, Sunita. I think that was a great kickoff to really unpack and to hear a little bit more on what a caring city is and a need for data as a starting point on this journey. I would like to invite also our audience online. Please share in the chat what you are thinking as a caring city for you. I think this will be really helpful for everyone as well. But let's travel together from Kathmandu, from South Asia, to all the way to East Asia, to Shenzhen, which is one of the first cities, actually the first city in China to integrate child-friendly, that is integrated in the Child-Friendly City Initiative, which Mona mentioned before. And we have the utmost pleasure to have with us today Yushan Xu, who's a research fellow at the Shenzhen Academy of Social Science, but also serves in a think tank on women and girls work in the Guangdong province. And we have the pleasure to hear today from Yushan Xu on a very tangible example on the work of how to integrate family-friendly workplace certification into the broader context of child-friendly cities. And we would love to hear about your experience in that space in Shenzhou and hopefully inspire others to take this in. Over to you.
Okay, thank you. Good afternoon. I'm Yushan Xu. I'm the research fellow in Shenzhen Academy of Social Sciences, but I'm also the supervisor of Shenzhen Women and Children's Development Foundation. Can you see my slide? Yes, I have the PowerPoint. Yes, thank you. Thanks to UNICEF and UN Women for this opportunity. It is my honor to share Shenzhen's pioneering practices, a city of 18 million people with an average age of 32.5. Next slide, please. Yes, thank you. As China's first city to institutionalize child-friendly city initiative with its government framework, Shenzhen pioneered the principle of child perspective urban design and led to China's first national standard for child-friendly public services. By 2024, 100% of Shenzhen's communities are child-friendly, benefiting 3 million children. You can see these achievements in this slide, such as the bursting feeding rooms in most public areas and hundreds of community centers for children to provide care services. In this way, Shenzhen links the care system to child-friendly city initiatives. Next slide, please. As a young and competitive city, Shenzhen has huge demand for affordable childcare and workplace flexibility. With support from UNICEF, we have initiated FFW program in 2021. These slides show the situation analysis we conducted, which shows employees prioritize flexible schedules and equal career opportunities for women during or after maternity as top solutions. We are happy to see that under our FFW initiative pilots, many companies now implement measures like breastfeeding room and hour, early child care, flexible work arrangement, and gender equality initiatives to support employees' child care. Next slide, please. In this program, the key achievement was the development of the first family-friendly workplace certification system in China, guided by UNICEF recommendation and the national framework. The system includes 40 indicators across 6 pillars: gender-inclusive attitude, equitable career development, maternity protection, caregiving support, flexible arrangement, and occupational health. The indicators are also categorized into 3 tiers. Companies must first meet all legal requirements. They should then adopt 15 universal practices based on UNICEF and China recommendations. Finally, they can implement an additional 15 innovative practices to go beyond and create a truly family-friendly workplace. These systems helps investors, governments, and employees assess employers using measurable, transparent, and standardized benchmarks, fostering collaboration to create family-friendly workplaces. We will launch this system on May 15th, the International Family Day, and would be very happy to share it with all of you. Next slide. There are many approaches to apply the FFW certification system, such as integrating this system into child-friendly city framework to further enhance the link between care system and CFCI. Other opportunities include CSR standards and ESG assessment. We will also consider different strategies for different types of enterprises. In Shenzhen, we are mobilizing the whole society to build family-friendly workplaces and will use the results as evidence to scale up and advocate national policies. That's all for my sharing. Thank you for listening.
Thank you very much, and thank you for emphasizing also this or bringing this multi-stakeholder approach alive through the responsibilities of workplaces and employers as well. So with that, we travel further from China to Southeast Asia, to Surabaya in Indonesia, and we have the pleasure to have Dr. August Iman Son Hashi with us today, and with a lot of respect, we're going to be talking to someone who has more than 3 decades of experience in urban governance. So I think it's a really great mix to the conversation today. And currently, he's the assistant for economic affairs and development in the government of Surabaya. And we would love to hear from you as well. What's a caring city for you? And also really just genuinely are interested to hear from your experience in terms of the opportunities, but particularly also the challenges that you experienced when implementing the Caring Cities approach in Surabaya. Over to you, please.
Terima kasih. Assalamualaikum warahmatullahi wabarakatuh. Selamat siang kepada Bapak Ibu Saudara yang hadir mengikuti acara di siang hari ini. Salam hangat dari Surabaya, dari Indonesia, merupakan bagian yang perlu diperhatikan di Asia Tenggara. Merupakan kehormatan bagi kami untuk berbagi praktek baik dalam membangun kota yang peduli, terutama melalui pendekatan kota layak anak yang kami terapkan di kota Surabaya. Bagi kami, kota yang peduli adalah kota yang mendengarkan dan merespon kebutuhan seluruh warganya, terutama anak-anak. Anak bagi kami bukan hanya masa depan, tapi juga warga kota di hari ini. Oleh karena itu, kami di Surabaya berkomitmen untuk membangun ekosistem kota yang mendukung tumbuh kembang anak secara holistik, mulai dari kebijakan, infrastruktur, hingga sistem perlindungan. Salah satu program unggulan kami adalah sertifikasi tempat kerja ramah keluarga. Melalui kolaborasi dengan sektor swasta, kami mendorong hadirnya fasilitas seperti ruang laktasi, cuti melahirkan, dan cuti ayah, serta fleksibilitas kerja bagi orang tua. Karena kami percaya kehadiran orang tua secara fisik dan emosional adalah bagian penting dari kehidupan anak. Tidak hanya itu, kami juga membangun dan mensertifikasi ruang bermain ramah anak sesuai standar nasional Indonesia, memastikan ruang publik menjadi tempat yang aman, inklusif, dan edukatif, termasuk bagi anak-anak berkebutuhan khusus. Partisipasi anak juga menjadi perhatian utama. Di Surabaya, forum anak aktif hingga tingkat kelurahan. Suara mereka tidak berhenti di forum, tapi benar-benar diintegrasikan ke dalam perencanaan program dan kebijakan kota. Inilah wujud kota yang tidak hanya bicara untuk anak, tapi bicara bersama dengan anak. Jawab tantangan pembangunan kota yang peduli, kami mengembangkan berbagai kebijakan perawatan anak berbasis komunitas. Misalnya melalui pusat pembelajaran keluarga atau puspaga di tiap kecamatan sebagai pusat edukasi pengasuhan positif dan layanan psikososial. Di sisi perlindungan, kami memiliki unit pelaksana teknis daerah pelindungan perempuan dan anak atau PTD PPA dan platform digital siap PPAK, yaitu sistem informasi aplikasi pelayanan pelindungan anak. Dan untuk selanjutnya kami juga meluncurkan Sitalas, singkatan dari Sistem Informasi Kota Layak Anak, yaitu sistem digital untuk merekam dan memantau aspirasi anak secara real time. Dengan teknologi, kami memastikan tidak ada suara anak yang tidak terlewatkan untuk kami perhatikan dan kami akomodir. Kami menyadari bahwa membangun sistem perawatan anak tidak bisa sendiri. Maka dari itu kami terus berusaha untuk memperkuat kolaborasi lintas sektor dari sekolah, dunia usaha, LSM hingga akademisi. Namun tentu jalan ini tidak tanpa tantangan. Mengintegrasikan nilai kepedulian ke dalam perencanaan kota membutuhkan perubahan paradigma bahwa membangun kota bukan sekedar membangun fisik, tapi juga membangun relasi dan nilai-nilai kemanusiaan. Kami mengajak seluruh kota untuk terus belajar dan berbagi. Karena bagi Surabaya, kota yang layak anak adalah kota yang merawat setiap anak dan setiap harinya. Demikian yang bisa kami sampaikan. Terima kasih. Wassalamualaikum warahmatullahi wabarakatuh. Salam sejahtera bagi kita semua.
Thank you very much for this explanation. And I would like to make a nice segue from what you mentioned about innovation, digitization, and the importance of that to our next speaker. And I'm very thrilled that we have, so we're moving actually from the government's perspective into the implementing also from a more enterprise and innovation perspective. And I'm really grateful that Nadira Yusuf is here with us, who is a serial entrepreneur, and her latest venture is Kiddo Care. And with no further ado, Nadira, please share a little bit on what have you been doing, what has been your journey in transforming care and bringing this to city development as well.
Thank you, Katya. Thank you so much for having me, share the kind of work that we do in Kiddo Care. And I'd like to first probably just give a very brief overview of what Kiddo Care is. And Kiddo Care is actually building Asia's leading care ecosystem. At least that's what we believe, that's our vision. A hybrid online and offline platform that connects families to trusted care services while supporting the holistic development of children. What started off as Malaysia's leading on-demand babysitting platform has now evolved into tech-driven, AI-driven care marketplace, care academy, providing professional training and certification, as well as physical childcare centers. So we work with a lot of technology, data, and AI to basically create personalized care experiences and drive scale and profitability across our region, right? So we strongly believe that technology can help to solve certain issues or inefficiencies in childcare. And so 6 years ago, we had this crazy idea of creating a platform, and we created a technology to basically help assist parents to get connected with trained and certified childcare service providers. We wanted to be able to provide high-level, high-quality childcare in safe, very flexible, very personalized care services to families with different kind of care requirements, right? So today we have supported over 200,000 families in Malaysia with over 20,000 caregivers empowered in our network, right? Consisting of both men and women. So caregivers is not just a woman's job anymore, right? So we have seen how our caregivers, so previously we've always been putting a lot of importance of making childcare accessible to families, right? But over the years, now that we've achieved 6 years of being in business, we have seen how our caregivers have also started to have their own families, right? And then they are usually burdened or rather held back to go out for work because of their own childcare challenges. And we started thinking, you know, what can we do for our own caregivers, right? And then we started to evolve our pop-up nanny services. So our pop-up nanny is basically temporary mobile childcare facilities that we set up usually in event spaces and whatnot. We evolved this into something more permanent in setting to allow for hourly drop-off, understanding how caregivers work. They will need to commute to their families whom they serve, and they work with variable working hours. So they may not need institutional childcare that caters for long hours. They probably will need just 2 hours, 4 hours, 6 hours of work whenever they require. And because they commute to work, we partner with public transportation hubs to allow for drop-off services to happen, right? So we have seen how this model has scaled beyond transportation hub to also include other public places like the mosque, right? In communities, we work with public libraries, we work with other event spaces, and we're working to further scale this, also in public hospitals. And we have seen how this has also transformed to not just engaging caregivers, but also different types of stakeholders and beneficiaries, like working mothers, who are now also embarking on flexible working, women who are entrepreneurs, needing some kind of care. And we work with technology to allow them to basically choose places that are closest to them, that are most convenient to them. And that's how we foster and work with partners to allow for care to be embedded in cities so that we can achieve both the economic and social agenda, Katja.
Great, thank you so much, Nadira. So I think this is a very practical and tangible example. And traveling further from Malaysia, from the metro stations, from the hospitals where there are care places included in urban design, let's move to India, where the situation is a very different one. And we have the pleasure to have Gaurav Mehta with us today. He used to be an investment banker, and since a long time, in the last, I think, 15 years, now the CEO of a social enterprise called Dharma Life. And Gaurav, it would be great to hear from you on how you have actually pivoted in your enterprise to create in spaces in urban cities or peri-urban spaces to connect actually provision of care and women's empowerment together. Over to you, and thank you for joining us from Seattle at this point of time for you. Thank you. Over.
Thank you, Katya. Thank you for having me in this conversation. So briefly, Dharma Life, as you mentioned, is a network of women entrepreneurs in peri-urban and rural India, which works on basically advancing women's economic power, agency, and leadership, and through entrepreneurship, climate resilience, and access to care. We are a network of 20,000 women entrepreneurs now and have reached more than 15 states and have 14 million people so far. First, to your question on caring, what is a caring city? I think so. For us, a caring city is a city which recognizes and redistributes unpaid care work, enables women to access livelihoods without sacrificing childcare, and also has a support system for the children, as well as builds ecosystems where care and skilling coexist, and so women can work and children can thrive. Now, how are we trying to get this vision operationalized for us? So we designed a program called Better Skills, Better Care alongside UN Women. At the heart of this program is that we use our women entrepreneurs in the local communities to kind of design and listen to the community in terms of what are the requirements. But the key issue we found in that was that while there were skilling opportunities and there were opportunities for childcare, rarely does access to childcare lead to actual women's economic empowerment and skilling, because if women are sending their kids there, the free time is used up in other household chores. So therefore, we came up with this idea of designing a space where women could come alongside and bring their children along And in that space, we would have vocational skilling for women, delivered in person and through digital platforms. We would have high quality kind of preschool for the children, or in case of older children, after school tutoring. But basically, the idea is that they come together, and through that, there's a kind of enhancement of productive time for women as well as for the children. We started this a few years ago and have now set up 3 of these centers, reached a few hundred beneficiaries so far. We're in the process of scaling this up. There were lots of learnings. I think given the 2 minutes I have, won't go into them, but I think a couple of things came out which were kind of, while we designed this, we need to scale it up. We have to partner with the government. So we're currently in the process of partnering with the government and having our centers as hub centers, but using government infrastructure as spoke centers. The other things which came out were that the other care topics, elderly care, basically food provision, other topics have to also be addressed. So we're now creating small enterprises to address, to have services around care topics, which women can avail of. So while we are obviously attempting to pass the burden or share the load between other family members, the other intent is to kind of have an ecosystem as what would have in normal urban areas for actually having these services and addressing the issues. So that's kind of what we're doing right now. And yeah, the last thing is we are working on assessing all this in a randomized control trial, to see, to have causality in our data, which has been quite encouraging and positive, but we want to obviously prove that. And yeah, I think, I'm pretty much out of time, but lastly, I think for us, care is seen as a core infrastructure, not an afterthought. And we believe any prosperous city should be inclusive and have care as a human right and embed that into the urban planning process. That would be my last point.
Thank you so much, Koraf. And I'm handing it over to Carla with one sentence. I've noted data partnership, ecosystem building, innovation, and inclusion thinking to transform cities to care. So I hope we all can do this and bring this together. Carla, over to you for closing us off with the last segment.
Thank you so much, Katja. Thanks so much to our panelists today. I think we all in the room learned so much from the public and the private sector experiences highlighted. We do appreciate the time for sharing yours. We're coming to a close of our event. And with no further ado, I would like to invite Rachel Joanne Bevan, the Director of Statistics at UNICEF, to help us with her closing remarks. Over to you.
Thank you so much, and thank you for the opportunity just to be able to kind of share in this discussion today. I won't say very much, kind of really being mindful of time, but also very mindful that actually probably what I was going to say has already been covered anyway. So obviously I work in statistics, but a lot of what I do is working with national statistics officers, particularly looking at the area of official statistics, so making sure we actually have the really kind of core information on, how many people actually live in a particular country, but also where are they located and some of that very basic information. But as we've really heard today through the different speakers from different country experiences, that's not enough. What we actually need is much more of that localized information to really be able to actually understand what are the issues that are most pertinent. When you're actually living in a city, the issues are very different to if you're living in a rural area. And of course, the issues which are important to one group of people, perhaps the elderly, are very different to those issues that are important, say, to children or to youth. So I just say throughout all of this, I think it's really important to just remember to kind of keep an open mindset, to not kind of make assumptions, but really to be in there to actually have those conversations with wide groups of stakeholders and to engage, from a really early stage, so we actually understand the different needs and the different kind of perceptions from across all the stakeholders, just from identifying issues, but also through to actually designing and then looking at the use of different services. But yeah, just to say as well, these issues were really also highlighted in our 9th Committee on Statistics, which we held back in December here in Bangkok. And at that meeting as well, at the top level, we decided to really promote a whole of society approach to building official statistics. And that, I think, is really recognizing what we've heard today as well. So that's been recognized there as well. but it's also been recognised, within UN Statistics Commission, when this year as well, for the first time, we adopted the new system of national accounts for 2025, and that's also recognising the whole issue around unpaid care services as well. So it is really important to bring all of that together, and many of the conversations which happen at that local level are being brought up actually to the highest level, and perhaps some of these issues that maybe previously were not very well understood, they're now coming into the official discussions and also into official statistics. So thank you everyone for sharing. Really great to hear the really different experiences at the practical level as well. Thank you.
Thank you so much, Rachel. It's really inspirational to see so many examples today. I know we're running out of time, but I just wanted to close with highlighting some of the amazing opportunities that we have ahead of us, building from the recently published UN Care Policy Framework that you learned today from both organizations. We are working together, as you know, to provide the support to governments and the private sector to ensure that your experiences, your innovations can take scale. And we'll be happy to take them to scale. And we do appreciate all of the important initiatives that are shaping up on the ground, translating subnational urban planning into solutions that will respond to the rights and the needs of the most vulnerable. And we look forward to continue this dialogue with you, and watch out for more. Thank you. This event is closed.